Hey everybody, I hope this finds you having a great day. Hey, we updated the Hruska clinic shoe list based on PRI science and concepts here at the clinic. And I wanted to talk to you about a few updates. So before I do that, I just want to remind everyone, as you can see on our shoe list, some of the criteria that we look for when we look at a shoe. One is we want it to bend at the toe box. Number two, we want it to have a firm heel counter that it doesn't collapse in. And three, when you go to kind of press in down here, you don't want to have it to be a lot of lateral heel give, and you don't want an asymmetrical heel. And with some of the shoes, we do want a mid-foot guidance or a sense of the middle part of the foot or the arch of the foot. Those criteria allow the foot to work more in a triplanar motion of sagittal plane, frontal plane, and transverse plane during the gait cycle that we would like. You're going to notice that I took off the Brooks Ravenna, not because it's a bad shoe, but we just found here at the clinic that wasn't a shoe that worked a lot with our clientele, even though it fit the criteria. I do want to talk to you about I have 3 pairs of shoes that I did add to the list, and they are a zero drop shoe. And a zero drop shoe is meaning that the heel and the toe box are level. And this is an Ultra Pro Vision 2.5, and this shoe fits all the criteria that we talked about. And if you try this shoe on, it not only has cushion, but it really provides some mid-foot reference for support where people can really feel the mid part of their foot. So when they go through the gait cycle, they can go heel, arch, toe. The other thing that we like about this shoe is it allows the toes to spread, because if you're getting good heel counter and midfoot control, the toes can spread out like they're supposed to in order for people to walk. So we've really, we just are trying this shoe out. Love your guys' feedback, but it's good for people maybe that have a hard time sensing the floor, or need a little bit more referencing of the ability to feel their whole foot in order to work in a triplanar fashion. The other ultra shoe I want you guys to talk about is if you need someone that needs more of a rocker shoe, if they have a limitation in their first metatarsal joint, this is probably the best rocker shoe that I've come across in years. And this is the Ultra Paradigm. And this shoe is a great rocker shoe. You may want to start slow with your patients with this, because they'll really feel like they're walking through their shoe and they're really rocking through their foot. So you may want to try this shoe and see what you guys think if you need a good rocker shoe, and I did reference that on the shoe list. There's also one called the Ultra Taurin. That shoe is good, but it doesn't have as much medial support. So if you have someone that has a lot of calcaneal inversion, or excuse me, eversion, it may not be the best shoe for them. But here again, you guys, just remember, not every shoe on the list is going to fit for everybody. It's just to give you guys different selection. You need to watch your patient walk. You need to see if they're where they're limited at during that gait cycle. Do your PRI testing to really determine what the best shoe is for your patient. I hope that helps. Have a great day.